Common adverse drug reactions, interactions, and contraindications. While most drug interactions, contraindications, and adverse effects are topics the pharmacist will review with the patient, the pharmacy technician should know that all warnings flagged by the computer system should be brought to the pharmacist's attention. There are also some high-risk medications that warrant extra caution and review when patients present these prescriptions or purchase these OTC products. The study of drug interactions and side effects is a complicated topic and cannot be covered adequately in this review. However, there are some key observations that the technician can make that are cause for alerting the pharmacist to review the medication profile. Any new prescriptions for the following products, especially for patients who are taking multiple medications, should prompt a review by the pharmacist. Medication, products that thin the blood, such as warfarin, Coumadin, Aspirin. Potential reaction, these medications can interact with other medications or foods to increase bleeding or decrease the medication effectiveness. Diet can also be a factor in the effectiveness of warfarin. Medication, products that affect the heart, such as digoxin. Potential reaction, other drugs can affect the metabolism of these medications, and small changes can result in significant effects, causing either toxicity or lack of efficacy. Medication, antibiotics, potential reaction, rashes and diarrhea are the most common side effects of these medications. Some antibiotics may cause photosensitivity, others can affect the metabolism of other medications. Medication, diuretics, potential reaction, changes in serum potassium and sodium levels directly associated with these medications can have serious side effects. Medication, herbal products, potential reaction, many of these products can directly affect the potency of prescription medications and should therefore be noted in the patient's profile. Herbal products should be carefully considered before being taken concurrently with other medications. Drug classification, dosage forms, medications often consist of very small quantities of chemicals known as active ingredients that are combined with inactive ingredients to make convenient dosage forms. Dosage forms are designed to help patients take medications by improving taste, appearance, stability, availability, and absorption. Some medications are prepared in more than one dosage form. The pharmacy technician should always ensure that the dosage forms dispensed are the same as those prescribed. Oral solid dosage forms, capsules are small, oblong gelatin containers filled with medication. Many patients prefer capsules over tablets because they are easier to swallow. Their gelatin exteriors become slippery when patients take them with water. Tablets are solid dosage forms. Tablets vary greatly in color, shape, size, weight, and many other properties. Some tablets are scored to facilitate breaking. Some are coated with substances that can delay absorption, extend the release of medication, or change other properties of the medication. There are several types of tablets, including the following. Buccal tablets are placed in the buccal pouch, the area between the cheek and gums, to dissolve. Sublingual tablets are placed under the tongue and dissolve rapidly. Chewable tablets are intended to be chewed before swallowing. Only tablets specifically marked as chewable should be chewed. Effervescent tablets contain mixtures of acids and sodium bicarbonate, plus active ingredients. These bubbling tablets release carbon dioxide and dissolve rapidly in water. Effervescent tablets should always be dissolved in a glass of water that patients then drink. These tablets should not be chewed or swallowed. Enteric-coated tablets are coated to prevent them from dissolving in the stomach, where they may be neutralized or rendered inactive by stomach acids. These tablets move past the stomach to dissolve in the small intestine. Troches and lozenges are held in the mouth while they dissolve. These tablets keep the medication in contact with the mouth and throat for an extended period of time. Pills were originally made from powdered raw materials, such as leaves, roots, or ground animal glands. The powdered material was mixed with a sticky liquid, such as sugar syrup, formed into a pencil-shaped rod, and cut into equal parts. Each subdivision was then rolled into a round mass called a pill. People often refer to any solid, oral, dosage forms as pills. However, very few official preparations are known as pills. When referring to any solid oral dosage form, it is more professional to refer to them as tablets or capsules, whichever is more appropriate. Controlled release products release medication over extended time periods to avoid high concentrations in the digestive tract, or to provide longer durations of action than are available through conventional dosage forms. Tablets, capsules, or in some cases, medication particles themselves are specially coated to release portions of the medication in the body at specific times. These dosage forms usually contain 2 to 4 times the regular dose of medication, which is released in the body over a period of 8 to 24 hours. The pharmacy technician must be familiar with these products so as not to mistake one for another. Confusing one dosage form for another could cause under- or overdosing that would potentially result in patient harm. Controlled-release products are identified by their manufacturers by various acronyms. Following are several examples: LA, long-acting; SA, sustained action; SR, sustained release; CR, controlled release; XR/XL, extended release; DR, timed release. Oral liquid dosage forms. Most oral liquid medications are dissolved or suspended in a liquid, usually water, but sometimes alcohol or another suitable solvent. Most orally ingested liquids also contain sugar and flavoring agents to improve their taste. Solutions are preparations in which the solid ingredients of medications are dissolved in a liquid, usually water. Solutions may have color but are usually clear. Suspensions are substances in which medication particles are suspended in liquid, the medication is not dissolved. In order to help the medication stay equally suspended, distributed throughout the liquid, an agent is added to make the preparation thick. Nevertheless, over time, ingredients can settle and collect at the bottom of the bottle. Stock bottles of suspensions must be shaken before dispensing. It is also necessary that shake well or auxiliary labels are placed on prescription containers. Reconstituting powders to liquids requires the addition of a specific amount of distilled water to convert them into solutions or suspensions. Because these medications deteriorate rapidly as liquids, they are manufactured and stored as dry powders. Distilled water is added to them immediately before they are dispensed. After reconstitution, these medications generally are effective for 10 to 14 days, and they usually need to be refrigerated. Many liquid antibiotics are reconstituted powders. Elixirs are clear, hydroalcoholic, combinations of water and alcohol, liquids intended for oral use. They often contain flavoring substances. Fluid extracts and tinctures use alcohol, water, or combinations of the two as their base, and they usually contain plant extracts as active ingredients. Spirits or essences are alcoholic or hydroalcoholic solutions of volatile substances. They contain such a high percentage of alcohol that they require storage in tight containers to prevent loss through evaporation. Syrups are concentrated solutions of sugar and water with added active ingredients. They may also contain alcohol. Emulsions are mixtures of oil and water. Over time, they usually separate into an oil layer on top of a water layer. As with suspensions, stock bottles of emulsions must be shaken before dispensing, and it is also necessary to place shake well or auxiliary labels on prescription containers. Topical dosage forms. Certain medications are used as topical treatments, which are applied on the body as opposed to taken internally. Most of these topical medications are used to treat the eyes, ears, and skin. In addition, the medications can be applied or inserted vaginally or rectally as creams or suppositories. Following is a description of the most common topical dosage forms. Ointments are greasy preparations, usually with a petroleum jelly base. They are good for delivering medication to areas of the skin that need protection. Ointments leave oily coatings on the skin. Creams are combinations of water, oil, and other substances. They usually do not offer as much protection as ointments, but they can be more appealing to some patients, because creams are less greasy and are usually absorbed by the skin. Lotions are like creams, but they contain more liquid and are applied more easily over larger areas of the body. Liniments are mixtures of various substances in oil, alcoholic solutions of soap, or emulsions intended for external application. They are often used for their heat-producing effects. Gels are semi-solid suspensions of very small particles, usually in a water base. Collodions are liquids that dry as flexible films on skin. Many wart, corn, or callus removers are prepared as collodions. Transdermal patches are topical delivery systems designed for prolonged action. Medications are provided in patches that stick to the skin with adhesives. When patches are applied, the skin absorbs constant amounts of medication over a time period ranging from 12 hours to several days. Examples of medications used in transdermal patches are nitroglycerin for angina and estrogens for hormone replacement. Suppositories are topical dosage forms. Usually manufactured in cylindrical, egg, or pear shapes, some are made for insertion into the rectum, others into the vagina. Suppositories may have local effects, but they may also contain medication meant to be absorbed by the body for a systemic result. Vaginal tablets are inserted into the vagina. Whenever typing directions for using vaginal tablets or suppositories, remind patients to remove any outer wrapping, such as aluminum foil, before insertion. Miscellaneous dosage forms. Aerosols are sprayable products that use pressurized gas and valve systems to deliver medications. They are most commonly used for topical application to the skin or for inhalation into the lungs and nasal passages. Chewing gum is also used to administer medication. With this method, medications are absorbed through the mouth's mucous membranes. The most common example of this dosage form, nicotine gum, delivers nicotine in consistent dosages that can be tapered by patients to help them with smoking cessation. Parenteral medications are sterile preparations that are injected with syringes. Insulin is the most common parenteral medication stocked in community pharmacies.